Welcome to Join Our Town. I'm your host, Juliet Arrington. Today I have with me Dr. Sandra Matthews Ford, MD, of the Internal Medicine Affiliates in Birmingham, Alabama. And we're going to talk about today diabetes. Welcome, Dr. Ford.
Thank you.
Good to have you with us today. Could you talk to us and, just tell us about, what is diabetes? And we're going to get into other elements of that, but would you give us some information on that?
Sure. Diabetes is a disease or a condition wherein the body doesn't produce or effectively use insulin. And insulin is necessary to process the sugar that you take into your diet. So this is how it happens. What happens is when you take in glucose or sugar, then it gets in the bloodstream. But the key is that it must get from the blood cells into the cell itself, out of the blood. So insulin is necessary to take the glucose out of the blood and into the cell. Insulin facilitates that. So because you really need the glucose in order to get the energy. So when people have a deficiency or don't effectively use that, then it stays in the blood and the blood sugar is high rather than getting into the cell. Insulin would be sort of the key that unlocks the cell so that the glucose can be taken up into the cell that it might be used effectively.
Okay, so if that insulin isn't, if that door is not open, so to speak,
yes,
then it's on the outside
right,
of the cell.
in the blood.
And
so that's the high sugars in the blood.
I got you. So could you tell us now the difference between, type 1 diabetes and type 2?
Yes. Type 1, it used to be called the juvenile onset, but you can get it at any age, but it's still more prevalent among young people. And what that happens in that particular incidence, the immune system begins to attack the cells that produce insulin. And so these people are, number one, they are totally insulin dependent, and so they will die if they do not get insulin. So, and it comprises about 10% of the total burden of diabetes as opposed to 95% of type 2. This is very, it comes on suddenly, the symptoms, as opposed to type 2, they may be more insidious and slower in onset, and you may not even really know that you have it. Now, the thing is with type 2, we're seeing more, it's not any longer called adult onset because we're seeing it in teenagers because of obesity and lack of physical activity. And here we are seeing more relative insulin deficiency and more insulin resistance. And this one, the burden of this, there are so many people that may not even know that they have that. And when we start to talk about the statistics, then we will see that. But this one can be, it can actually be, you can actually prevent it in some cases or slow down the onset of it. So it's really associated with family history, it's associated with being overweight, physical inactivity.
Wow, physical inactivity.
Yes.
Okay, I won't talk about that much anymore. But could you tell us also symptoms? When does a person, what are some of the presenting symptoms for a person that has diabetes?
Well, you may urinate a lot, you stay thirsty, may stay hungry, lose weight, fatigue, blurred vision, numbness or tingling in your fingers or hands, wounds that will not heal properly.
Wow. So could you tell us how prevalent, diabetes is in the population?
Yes. On a national, looking at it nationally, there are 26 million people who have diabetes. 18 million of them have been diagnosed. There is a pool of 7 million people that are not even aware that they have diabetes. And looking at it on a state level, there are about 435,000 Alabamians that have diabetes, and there is a pool of about 200,000 people that don't even know that they have diabetes. The national incidence of diabetes is about 8.3%, but for the state of Alabama, it's about 12%. So we're in the top 3 in terms of the incidence of diabetes. And then when you dissect it further in the state, we see that there is an area called the Black Belt, where the incidence goes up from 12% in some counties to 17%. These are areas, the Black Belt is an area that there are about 12 different counties that we would call third world Alabama, where we see the underprivileged, the uninsured, and those that don't have, intake of adequate medical care.
You just talked about the Black Belt, and I know that you have a ministry that goes, and you've gone into the Black Belt and service people. So could you tell us, about, your medical mobile unit that you bring in, and then how, that's helping with the education for diabetes? Yes.
We have, my husband and I have, we founded the Spirit of Luke, which sponsors an initiative that goes to the Black Belt. And our goal is to help and assist in eliminating some of the healthcare disparities that exist there. So we go to different counties, Perry County, where Uniontown is, and we see a lot of diabetes. It is just amazing. I would say 8 out of 10 will have diabetes. Some of them already diagnosed and some of them are not. So with this state burden of about 200,000 people that are unaware, we see people all the time presenting with 300, 400, 500 even blood sugars that never even know that they had it because they have not had access to health care, and they present with these symptoms. We see about 9 out of 10 of them have hypertension. So the Black Belt is just an enormous burden as far as diabetes is concerned.
So what is treatment? What are you doing if you have like your type 1 diabetic, your type 2, what are some of the things that you do to help treat those people in those areas?
We very seldom see that many type 1s, but the burden of those are type 2, and we do carry medications. We have insulin. We have diabetic educators that go with us sometimes. We have nurses, we have physicians, we have someone to provide eye care for them. So that really comprehensively, they really need more because they would not get any education as far as how to really take care of diabetes. Diabetes really requires that you have a plan, that you are taught how to monitor your your sugars, that you are taught about taking care of your eyes, your feet, and just how to count carbohydrates, what you should eat. But these people, there aren't any diabetic educators. We bring them when we come to the Black Belt. So, I mean, there are oral medications that can be taken, and there is insulin, of course, and all type 1 diabetics, they must have insulin. We take insulin, and there are other injectable medications that we use now for diabetes as well. So we try to take a number of different kind of medications. We have the nurses there that will actually show them how to monitor their sugars, how to use the glucometers, and sometimes we've had to on the spot teach them how to use insulin and hope that we'll be able to get them to a facility that they will be able to, get further care.
Well, Dr. Ford, as a healthcare provider, what do you find to be, I know we talk about in the Black Belt, and specifically here in Uniontown, but for other areas where you hear the commercials, you hear the things on television, why do you think people are just being slow to go and take care of that issue?
In terms of
the diabetes, yes ma'am.
I think people are just afraid and just unawareness, lack of the economic factors, education, transportation, access to care. There's just any number of different things that are barriers to health care.
So for a person, I know you were saying some of the symptoms, a person's going to the bathroom frequently and all of that. So do you think sometimes people are just not realizing that they have an issue and they just think that's normal?
Yes, they do. It is amazing. They say, well, I have been going to the bathroom a lot. I have been feeling kind of tired, but because they are where there is no care, they tend to accept what they have and are willing to just, okay, I have what I have, I'll live with it or I die with it. So that they just pretty much accept it.
Are there any special factors that increase a person's risk of getting diabetes?
Yes. There are some factors that you cannot change. For instance, age. Onset of age is usually older, like 45 in terms of type 2 diabetes. Number 2, you cannot choose your family history or your relatives, so there's a higher incidence in first-degree relatives. And third, you cannot choose your ethnic group, so that we see a higher incidence in American Indians, in African Americans, people of Hispanic origin, and people that are from the Pacific Islands. And so those are some of the things that, that you can't control. But there are other factors, for instance, obesity. The burden that we're seeing now with obesity and physical inactivity. There are other factors like a person that would have gestational diabetes, that is diabetes during pregnancy. Their risk to develop diabetes later is increased. Or someone who had a baby and the baby's more than 9 pounds. The other issue is polycystic ovarian syndrome. Certain things increase your risk. Some of them that you can help to prevent or delay, for instance, obesity and physical activity, those are modifiable risks. The others are not.
Okay. Wow, that's such good information. So some of the, well, you talked about the age differences, some coming on as a relating to age. How can people kind of prevent and become more proactive, because we are getting older,
Yes.
and that doesn't have to be a bad thing, but what are some things that our viewers can think about if they're in their 40s, that sort of thing, that could help play a role in decreasing their risk of diabetes?
Yes, I think this issue with obesity and physical activity has just got to be, addressed, and particularly in younger people, because what we're seeing, the difference that is really very striking is that we're seeing it in teenagers, type 2 diabetes, purely because, or mainly because of obesity and inactivity. In terms of obesity, on a national level, there are about 17% of teenagers are overweight, 13% are obese. And the statistics show that even in Alabama, that about 23% of kids don't actually even have not one day of 60 minutes of physical activity. And there's a 22% of the population of teenagers that don't even eat vegetables. And you're supposed to have 5 to 9 servings, but nowhere near that. So we combine this burden with physical activity and obesity, which is just rampant. We're seeing now obesity such that it's 3 times the rate that it was 1 generation ago. And that is alarming, because we're seeing now that for the first time ever, the lifespan will be decreased relative to the previous generations.
Well, Dr. Ford, this time is getting away from us, and we have only a few seconds here, but we want to thank you, first of all, for being with us on Join Our Town and talking to us about diabetes and talking to us about, what the work you've done in Uniontown. And so we want to thank you for being with us, and we thank you for tuning in to Join Our Town. And I'm your host, Juliet Arrington, and we will see you the next time. Thank you.
Did you know that obesity can be both social and physically adverse to your child's health? I'm Dr. Jacqueline Stewart of Magnolia Pediatrics South in Birmingham. There has been a doubling of obesity among our children. Good eating habits are so important. Please practice good eating habits. No salt, no sugars, and limit the fats. Thank you very much.
Sorry, I was wiping my face.
Hello and welcome to Join Our Town. I'm your host, Juliet Arrington. Today we're going to talk about the necessity of a school safety plan, and I have with me as our guest Charlie Parker, who's the assistant principal at Gaston City High School here in the city of Gaston. Hello, Mr. Parker.
Hello, how are you doing?
Good.
Great.
Now we're talking about the necessity, of a school having a safety plan. So what is the necessity? Why is it necessary for a school to have a safety plan?
I think it's very important for schools